It is Health Monday, and Jacob Johnson joins us this morning. He is flying solo on this Monday morning. Good morning to you, sir.
I find that I look better solo.
Well,
we put a better presentation out there when I'm solo.
And so that just leaves Jared out then, right?
Right. You know, I didn't want to say it as direct as that, but yes, we do better when Jared's not here.
Coronavirus. That, we talked about this about a month ago.
Yeah.
Has your thoughts changed on this since last time?
Yes and no. I'm not in any more of a panic than I was last month. And I guess to some extent, yes, simply because on behalf of the public, this is the first time in the 2-3 years we've been doing this once a month that we've ever repeated a subject the next month. Yep. But it's all anyone wants to talk about, largely driven by national media and governments responding to it. And so it's all people are hearing. It's all they want to talk about. So I thought the only thing I can talk about this morning is coronavirus. If I come in here with any other information, no one wants to hear it.
You'd be stoned, man.
Yeah, everybody wants to talk about coronavirus. That's all they want to talk about.
What's the latest worldwide numbers of this coronavirus?
And I prepared these last night, and I thought, these numbers almost don't matter in that if you look at 10 different resources, you're going to see 10 different sets of numbers. I kind of took the one that looked to be the most aggregate, and went with that. So as of last night at 7 o'clock when I was putting these numbers together, it's different right now, but as of last night at 7 o'clock, over the course of the world, we've had a little over 100,000 cases. That's a fair number. I mean, for something that didn't exist 6 months ago, 100,000 cases. Of those, 62,000 plus have fully recovered and they're sitting at the house right now feeling perfectly fine. 43,000 still have it. They're just in the middle of their course. They're still working on it. But there have been 3,800 plus deaths across the world. 3,800 deaths from this disease. Now, of the 43,000 or so that have it right now, 86% of those are mild. They're also sitting at the house right now. They're not hooked up to tubes. They're not, dying as we speak. They're sitting at the house waiting for it to go away, but they're fine for the most part. What is concerning? The big thing you're seeing everywhere, the reason why is this such a big deal? Well, if you do the math right now, the death rate from people that get this is 3.5%. Big pause right here. One, that's a big number for a disease like this. 3.5% may not sound like a lot, but that's way higher than most viruses. Way higher than most viruses. However, what you got to keep in mind, the National Institutes of Health came out, Friday, Saturday maybe, and said, you've got to be patient on that number because there are most likely so many cases. We know about the deaths. When it's a death, it's chalked up. That number's accurate. But the number of people that have actually had it is probably so much higher than we realize. Actual World Health Organization estimates are that it's going to end up being around a 1% death rate. Still high. That's 10 times higher than the seasonal flu. But 1% death rate, 99% full recovery rate. So it's bad, but it's not that 5%, 6% number that we feared originally.
Let's break it down further with the United States and Alabama.
In the United States, and again, these numbers change rapidly in 10 different news sources, 10 different numbers. But from what I can pull out, as of last night, 530 some odd cases in the United States. That's a reasonable number since we didn't have any until a month or so ago. 538 total, 22 deaths. We have lost 22 people in the United States. 15 of those 538 fully recovered, back to work. Nothing happened. They're good to go. 501 still active, of which 493 are mild. We have right now 8 people in this country that are considered to be in serious condition, serious or critical condition. We have a grand total of 8 people right now in the entire country. 22 have died, 8 people currently in serious condition, which does follow the numbers that we've had reported from the world. It's not that much different here. But again, like I say, it's usually going to turn out to be about a 1% death rate, people imagine. But what really everybody in this room, or not in this room, everybody through that camera right there wants to know is, Jacob, I live in Central Alabama. What's going on right now in Central Alabama? The answer is, as of yet, nothing. However, 34 states in the D.C. area have it right now. 3 of those states that have it are Florida, Georgia, and Tennessee. So the National Institutes of Health spokesperson came out roughly a week ago and said, I estimate 1 to 2 weeks for Alabama. It's going to be in Alabama. And that's reason I want to talk about it this morning, let's get out in front of it. At some point in the next week or two, you are going to read that someone in Alabama has it, or 2 or 3 or 4, and that number is going to grow. You are going to see it near you, relatively speaking, at some point in the next week or two. So let's get ready now. Let's not wait 2 weeks and hit the absolute panic button. We're going to see it. And
Who's going to struggle with this more likely with this coronavirus?
like most viruses, it's going to be those 65 and older, which again is probably the bulk of our primary viewing audience this morning. 65 and older, plus those with a chronic disease that can affect your immune system. Diabetes, by the way, is one of those. I mean, so it's not just some obscure chronic disease that a very few people have, but yeah, some very common chronic diseases do affect your immune system. And so lung conditions, asthma, COPD, emphysema, like I say, diabetes, those type of diseases, they're going to struggle more. So 65 and up and those with other conditions is the main thing you're going to see.
So are the signs similar to the flu?
They really are. The 3 primary things so far: fever, cough, and shortness of breath. It can feel like the flu. It can look like the flu. It's hard to differentiate, which is a big deal right now because this is flu season. And so we need to be able to differentiate between the two. Similar to other viruses, the symptoms appear anywhere from 2 days after you've been exposed to it to 2 weeks after you've been exposed to it. And that's why it's so easy to spread, by the way. You've had it, you're exposed to it, you can be contagious with it in another 2 weeks, not even know you have it until, so you can be spreading it without knowing it. And that's why it's so complicated. What they've shown mathematically so far, and I don't know who figures this out, this is amazing to me. A person with it, on average, infects 2.2 other people. So roughly 2 other people. For every person that has it, I'm going to give it to 2 people on average before I know it, before they know it, and here we go. And so I'm doubling as I go.
Right.
And so that's what's causing the growth. But again, 65 and older, which is our primary audience, do need to be the most mindful of it.
Well, what are some things we can do? We talked about last month, if you're not going on a cruise or something like that, you're not so susceptible to it. Things have changed just a little bit. So what can we do to prevent this?
Things that I would tell everybody out here to do anyway, pretty much, with no matter what you have or don't have. Avoid close contact with people who have it. Right now, they're defining that as about 6 feet. That's what they're mostly concerned about. So, unless you're in the room taking care of someone that has it, you're not going to catch it necessarily at passing by 2 aisles over at a Walmart.
Right.
That's not how it's spread. But those who are in direct contact, 3 to 6 feet, cover your mouth when you cough, cover your nose when you sneeze. Don't do it with your hand and then touch all the doorknobs. Do it with a tissue. Throw the tissue away. If you don't have a tissue, do the vampire thing. Cover it with your sleeve, and then wash that shirt when you get home. But cover yourself with sneezes and coughs. If my kids hear this once a day, they hear it 1,000 times, even when there's not a coronavirus outbreak. Don't touch your face. Get your hands out of your face because you're most likely to contact it on your hands. Don't touch your face. Get your hands out of your face. High touch areas, doorknobs, things like that. Clean them once a day. Lysol, whatever. If you have to go out in public and grab a doorknob, most of us are wearing long sleeves at this point. Stretch your sleeve out just a little bit and grab that. Or have a tissue with you and grab that. High touch areas are buggies at the grocery store. Use the wipes. High touch areas are dangerous. Hey, stay at home if you don't feel good.
Imagine that.
Employers hate to hear me telling people that, but stay at home if you don't feel good. Don't be that typhoid Mary person that's giving it to everybody else. And here's the crazy one. Wash your hands, people. You'd be shocked at the number of people that just rarely, if ever, wash their hands. Wash your hands at least 20 seconds, and when you're washing them, you have backs of your hands. Some people don't seem to know that. This is not washing your hands.
Yeah.
You have backs, and you have fingernails. Wash your hands for at least 20 seconds. Fronts, backs, in-betweens, fingernails. Get that done. It does take 20 to 30 seconds.
It's not just turning on the faucet and putting your hands under the water.
Get the soap, scrub them. And the drying process is important for getting rid of germs as much as anything else. Don't do it on your pants. Use a towel if they're there. The stuff that the soap has loosened up on your skin with the germs on, that washes them off. Yeah.
We're up against the clock this morning.
Sorry.
But 30 seconds to tell us what we do if we get this.
There's not a medicine for it. But again, stay at home, except to go to the doctor. separate yourselves from others in your home. Get your bedroom, lock yourself off. Use a separate bathroom if possible. Just kind of separate yourself from others in the home. If you're going to visit your doctor, call ahead. Let them know you're coming. They can separate you when you get there. Let's not throw you in general population, right? Separate yourself. Wear a face mask if you are sick. Don't wear a face mask if you're not sick, unless you're the caregiver right in the face of somebody who's sick. You don't need a mask. Cover yourself, wash your hands, all the things we've talked about.
Appreciate you coming this morning. I know it's a busy time for you.
It's busy. That's okay.
All right. We thank you for joining us on this Monday morning. We've talked about coronavirus update, and
Again.
we'll talk to you tomorrow morning here on Daybreak Live.